My name is Saskia. I'm a diabetes nurse educator from South Africa. Most of the people in South Africa are using taxis as a form of transport, 41.6%. That means that is half of our current population. It is estimated in 2014 that 1 out of 11 people do have diabetes, and 1 out of 4 are not even aware that they have diabetes. That's why I want to talk to you about macrovascular disease. Macrovascular disease is a long-term complication due to high blood glucose caused by increased blood sugars. So what happens within our body? Atherosclerosis is a disease that affects the blood vessels called arteries that carries blood to organs all over the body. Normal arteries allow blood flow free. However, these arteries can become hardened and narrowed by deposits called plaque. Plaque are made up of cholesterol and inflammatory materials. Plaque build up over time and can decrease the amount of blood flow to the area that the arteries supply, that influence the oxygen and nutrients supplied to the area. Damage to these blood vessels can cause stroke, which means if you have diabetes, you have a twofold increase to having stroke. It can cause damage to the heart, causing a heart attack, meaning that you have a fivefold increase of having a heart attack if you have diabetes. It can also cause damage to the main vessels to the feet that can lead to ulceration and even can lead to amputation. The good news is that we can prevent this. So let's go and have a look on how you can take control. When you're a taxi driver, there are certain road rules you need to obey in order to reach your destination safe, like a stop street or perhaps a traffic light. Within diabetes, there's also certain rules, or we can see it as blood glucose targets in order to prevent complications. The test that is being done is called an HbA1c. A HbA1c shows how good your blood glucose control is over a period of 3 months. Large studies have showed that lowering blood glucose would be beneficial to prevent complications of macrovascular disease. The studies are called the UKPDS and the DCCT. The ADA, which is the American Diabetes Association, suggests an HbA1c of 7. But remember, you need to discuss this with a healthcare professional. Ensure to monitor your HbA1c every 6 months to see if you are getting the green light on your blood glucose control. Without the correct amount of fuel or oil, your vehicle will break down, just as your body will break down without a balanced diet. Let's talk about food and fats. Not all fats should be avoided, as we do need healthy fats. Healthy fats are fat that your body needs. Monosaturated fats are good fats. Some examples are olive oil, peanut butter, and avocado. Saturated fats are fats that should be avoided. That is types of fat that at room temperature are hard, like fats on meat or on chicken, fresh cream or full cream milk. The recommended cholesterol levels are LDL, which is the bad cholesterol, 2.6, HDL, less than 1 in men, 1.3 in women, and triglycerides less than 1.7. Healthy eating is important. Healthy meaning balance. You need to include the variety of the following: lean meats, vegetables, whole grain, beans, lentils, increase in fiber, and also include 2 portions of fish per week, like sardines or pilchards. Include 2 fresh portions of fruit, and also it is important to drink water. To check your tire pressure, it is shown by the UKPDS and the DCCT that you need to control your blood pressure. It is recommended by the ADA to have a blood pressure of 130/80, and this should be checked on a regular basis. Lifestyle management, like a balanced diet, which will be discussed later, exercise, weight loss, can assist with blood pressure control. If lifestyle does not help, you might need to have medication. Factors include exercise. The American Heart Association recommends to do 150 minutes of exercise per week. Exercise could be moderate. Moderate meaning to be able to talk without being cut out of breath during an exercise session. perhaps like doing a brisk walk, or vigorous, like cycling or running. Start by doing 5 to 10 minutes a day and increase each week as you see your fitness level improves. The Steno trial showed that by exercising, having a balanced diet, and even by stopping to smoke, you could decrease your risk for macrovascular complications to 50%. So let's go look at a practical way how to do all of this above. Exercise in your daily routine is really easy. Let's look at a few practical examples which you can do in the comfort of your own home, or even when you travel, or even if you can't even do much. This is a stepper that you can use at a gym, or perhaps buy a mobile unit like this. Next, this is called an exercise ball, which is very good for your core because you need to maintain balance. Let's look at an example of stomach exercises that you can do. Always to remember during exercise is to breathe deep, as oxygen is very good. A resistance band. There are numerous resistance bands that you can do resistant exercises on it. You can also perhaps do exercises for your arms, or even to work the arms at the back. If you're not into resistant exercises, you can always join a yoga class where you can work on the yoga mat. Last but not least, you can also do exercise within a chair if you're not able to be mobile. It's easy and in the comfort of your office or at home, just by lifting your legs so that you can increase blood flow. Exercise are always very important, and it can contribute for weight loss and also for stress. And this is just an example of running, or perhaps swimming, or hitting a ball. These are just small things. If you can't plan your day of exercise, you can perhaps do cleaning of your house or washing of your car. All these few things can add up for exercise in your day. Looking after your feet is just as important to prevent macrovascular complications. Let's look at a practical session on how you can look after your feet in the comfort of your own home. After removing your shoes, make sure that there's no redness, which could indicate that your shoes are not fitting properly. Make sure that your shoes are widely fit and not too tight over the toes and especially at the back. So at home you can make a simple mixture of sugar or salt mixed with oil in order to have roughage that you can apply to your feet. Scrubbing your feet on top, at the back, at the bottom will help to lose all loose skin. It is important as the average person walks over 200 million steps within their lifetime, looking at an age of 80, which means it is equivalent of walking about 5 times around the earth, right on the equator. After washing or scrubbing, you can rinse your feet and dry them. Important to note is dry thoroughly in between the toes. You don't want any moisture to be trapped there. After your feet is dry, if you can't see at the bottom of them, you can use a mirror, a hand mirror or any mirror, to look if there's any abnormalities or dryness or cracked heels even that you need to inform your healthcare team to assist with to prevent further complications. You can also add a little bit of moisture on the top, at the back and at the bottom of the foot. Try not to put any moisture in between your toes. Just as with water, you don't want it to be wet. That can cause further complications for fungi or infections to breed. Fuel for your taxi is just as important as fuel for your body. So let's talk about portions. Looking at carbohydrates or starch, it's a fist size, meaning for pasta, rice or even pap. Protein should be the size of your palm and not thicker than the side of your hand. It should be lean without any excess fat. When we're talking about vegetables or salad, 2 hands, that should cover more or less a quarter or a half of your plate. Let's look at a practical example. The size for your starch, palm size for your protein, and half your plate should complete it with salad. Doesn't this look delicious? Are you filling your taxi with the right feel? In conclusion of macrovascular disease prevention, remember the following. Know your HbA1c, check your blood pressure and feed. Ensure a balanced diet with healthy fats. And also stay fit with exercise. In doing all of these steps, you will ensure a safe journey. There might be many people on your journey during your life. Remember that you are the driver and you should stay in control.